Today is World Hypertension Day, so let's talk about this very important matter and a silent killer, if you like. Now, if you are a lady, now, I mean, it's not only a lady's matter, men also do. So if you are thinking of enhancing your complexion or your body parts, you may want to think twice about the decision, because medical professionals warn that bleaching and body enhancement products have the potential of causing hypertension. I mean, you didn't know, I guess. Now you know. Now, research has concluded that some bleaching creams containing steroids and mercury that leave the skin with stretch marks can have a detrimental effect on the body, increasing the blood pressure. Emmanuel Bright Kweku of our science desk interacted with nephrologist Dr. Elliot Cranton Tanner on some possible causes and risks of hypertension as the World Mark Hypertension Day, and has this report.
It has become a common practice in Ghana for many women and some men to lighten their complexion and enhance their body parts. With varied reasons for the skin enhancement, many people seek after various skincare creams and other medications like pills to have their desired light skin. But it is imagined that skin bleaching creams and pills can potentially cause hypertension, otherwise known as high blood pressure. Dr. Elliot Cranton Tanner is a kidney disease expert at the Konfanoti Teaching Hospital.
Some of these creams that they use to become fair have a lot of steroids in it. Okay, they have a lot of mercury in it, and they have hydroquinone. Now, these steroids, when you apply, you see, what they don't know is that they say, "Oh, I'm just applying it to my skin." Yes, when you apply something to your skin, what we don't know is that there are very small vessels that are in the skin. So it is invariably absorbed into your system. When you absorb some of these steroids into your system for a long period of time, of course, that is what causes them to bleach. You become fair, you thin out and all. That will lead to the hypertension. So steroids directly is a cause of hypertension. Now, the other thing is that these steroids can also lead to diabetes. And diabetes, when not controlled for over a period of time, it can lead to complications like hypertension, especially when it's affecting the kidney. And that can also lead to hypertension.
A 2023 Integrated Africa Health Observatory report declared skin bleaching as a global public health concern, with 80% of African women regularly using skin whitening products. The prevalence rate of the menace in Ghana is pegged at 39%, as many women continue to resort to cosmetic creams to have a skin believed to be the most sought after by Ghanaian men.
Might be some creams that probably might not have these contents that we are worried about. Okay, probably it doesn't have mercury, or it doesn't have, steroids in it, or it doesn't have, and probably it helps your skin to look nice. Probably that is okay. Maybe aloe vera, or it has, natural things. I don't have a problem with it. But the point is that how many of our women look at content? It is so important that we realize that it probably is an FDA component also, because the amount of steroids in those creams are so high that they could lead to problems.
Disturbingly, some expectant mothers have caught on the vogue as they take in medications in attempt to bleach their unborn babies.
Another thing that I also heard, very interesting, that nowadays women actually take prednisolone, PE they call it. And now it is not just to make themselves fair or probably to make their butts bigger and all, but I heard that now people even use it to make when they are pregnant, so their children will become fairer.
Skin bleaching is only one of the many causes and risk factors of high blood pressure, while family history and aging are termed uncontrolled risk factors of the disease. Poor dieting, intake of excess salt, and sedentary lifestyle are common causes of the disease.
Hypertension exists, and it's not the disease of the rich alone. The poor are getting it, male, females are getting it, but you and I can do basic things to prevent ourselves from getting it. And if we are told we have, it's not a death sentence. If we take our medications and exercise, cut down on our salt and eat well and all of that, chances are that we will not get the complications and we will live our lives to the full.
As this year's theme for World Hypertension Day emphasizes, measure your blood pressure accurately, do well to control it, and rest assured you won't live longer. Reporting for Joy News, my name is Emmanuel Bright.
All right, so let's deal with this very important matter. And of course, I didn't know that if you are undergoing body enhancement, you should be worried about hypertension. All right, so, what should you look out for And how do you stay safe in this environment? Dr. Florence Akumia is a cardiologist fellow in training. Dr. Akumia, you're welcome. Second time here. Right. And of course, Dr. Jacqueline Thompson, a CEDU family physician, also with me here in the studio. Dr. Jacqueline, you're welcome.
Thank you.
So the clip that we just played, skin bleaching and body enhancement. How connected are these to hypertension? Let me start with you, Dr. Kumia.
Okay, so I think Dr. Cranston Elliott did a good job of explaining everything. And essentially, what it does is that it causes a hormonal imbalance. It can cause what we call Cushing's syndrome. And that hormonal imbalance will cause hypertension. So that is one of the secondary types of hypertension. So with that, you know the cause of the hypertension. But more commonly, we have the essential hypertension that you really don't know the cause, just that we know some risk factors for it.
And then I think a lot of people will be watching this and they will be scratching their heads and say that how is this possible? That I'm bleaching and the effect of that beyond the fact that I may have skin issues in the future. I also have to deal with hypertension.
Yes. So a lot of, all medications have side effects. And oftentimes, most of them, sometimes when you use them for a long period and you experience those side effects. So steroids have medicinal value. We use it to treat a lot of conditions. But long-term exposure to it offsets the balance of your hormones and then predisposes you to hypertension. Now, those who are using it over the counter, they may not be using it at an appropriate dose, and they may be using it for too long a period, and that's why they get hypertension from it.
Then bring in Dr. Jacqueline. So today we are celebrating World Hypertension Day. And how serious is this topic?
Okay, so hypertension is become a global problem. And worldwide, currently about 1.4 billion people are estimated to have high blood pressure. Half of those people don't know that they have high blood pressure. So they are walking around and then all of a sudden they suffer a stroke or they develop blindness or any of those complications.
And the reason is that they've not checked, so they don't know their health status.
Yes, exactly. And I mean, it's not the norm for us to go to the hospital when we are not sick. So most of us feel that we are fine, we're walking around, and then the blood pressure is high. There are no symptoms. That's why hypertension is called a silent killer. So then it comes at you unawares. So that's how terrible the problem is. And as time goes on, the problem is increasing. So we need to do something about it now.
And from where you sit, I mean, how widespread it is in Ghana? You give us a global picture. But in Ghana, how bad is the situation?
So the situation is getting worse and worse. I mean, as we go to run our clinics every day, we see quite a number of people, about 60 to 70% of the patients that we are seeing in our clinics, that's for the primary care physicians. We see this number of patients who have high blood pressure. So the numbers are increasing, and it's increasing at an alarming rate. And all this is also because people don't know exactly what they are doing wrong or they are doing right. We are not eating as we should. We are not eating healthy food. We are not exercising. We are living a sedentary lifestyle. So all these things are contributing to the problem.
I'll come back to talk to you about the causes and the ones that we should look out for. But Dr. Kumia, this week we've been very heavy on kidney and dialysis treatment because Parliament decided to increase the dialysis treatment for public hospitals with the passage of the fees and charges. And then in the course of the discussion, we got to know that one of the ways to develop kidney issues is that if you are hypertensive. And as a cardiologist, I'm sure that you attend to them almost on a daily basis. How bad is the situation from where you sit?
Yes, so it is very bad. Chronic kidney disease and hypertension are really interrelated. It's actually bidirectional. If you have hypertension, you can develop chronic kidney disease. And if you develop chronic kidney disease from any other cause, you can develop hypertension. So oftentimes, if you have chronic kidney disease, you're definitely going to have a high blood pressure. And oftentimes, it's more difficult to control in that population.
And I mean, so you get to see these cases almost on a daily basis?
Yes, like she said, hypertension is one of the leading causes of people to present to the OPD or even to the emergency because they come with hypertensive emergencies. So what it is that current statistics says about, if you take about 3 people, one of them has hypertension. So about 33% of the population from 30 years to 79 years has been found to have hypertension.
30%?
33%.
33%.
And in fact, the data shows that it was even more prevalent amongst women, which was about 36%. So there is a high prevalence of hypertension. Imagine taking every 1 in 3 people among that age group having hypertension. So eventually you're going to find out that a lot of people have hypertension, and like she said, is underdiagnosed. A lot of people do not know they have hypertension. For those who know they have hypertension, a lot of them are not being treated. Those who are being treated, a lot of them are not even achieving the targets that they need to achieve. And that's why we have a lot of the complications like chronic kidney disease developing.
And then in understanding this issue further, I mean, we got to understand that Konfano Teaching Hospital, for example, same Dr. Tano we spoke to, that they did some research and it came up that 2 out of 3, in terms of the age brackets, now between the ages of 18 and 30, they recorded more people with hypertension, and it was quite staggering for them. I mean, I thought this was an ailment for the aged and the rich, and our younger people are also contracting this. What could be the possible cause? Is it lifestyle, or the kind of food we are eating, or the general stress in the system?
Okay, so...
Yes, but perhaps I'll start with Dr. Jacqueline, and I'll come to Dr.
Yes,
Kunya.
so I think you hit the nail right on the head. The causes of disease in this age group, 18 to 30, and even sometimes younger people have high blood pressure, and this is because of the lifestyle. It's got more to do with what we are eating. So now we westernized our diet. We are eating a lot of fast foods, and this contains all the things that we are not supposed to be eating: trans fats, saturated fats that we are not supposed to be consuming. And then life has become more sedentary. Our younger people are not going out to play, especially the children that are coming up, not playing out as much as they used to, because there's increased screen time. And then the kinds of food that we are eating also contains a lot of salt and then oil. So those are some of the things that are causing the issue. So it's mainly a lifestyle disease.
But Dr. Kumia, the danger here is that, I mean, you may come to understand that you are hypertensive. But the more dangerous aspect is that if you don't treat it, then you develop into secondary issues like kidney failure and the rest. And so it becomes very important that we take care of this matter very seriously. But the ordinary Ghanaian, does he take this serious?
Okay, so current data, Ghanaians have been found to have a poor health-seeking behavior in that we don't initiate seeking health care. It has to be prompted by something, by illness most often, or maybe if it's compulsory for an occupational requirement, then we go and have a health screening. But ideally, you should be having an annual medical screen. And
some say four times in a year.
If as often as you can, but at least once a year. How often it becomes depends on what is found once you go. So if you go and you declare to have a clean bill of health, as often as you can, check your blood pressure, do a few tests, you do. But at least once a year, you should have it. Four times a year
age is an issue here, and we have more younger people getting it. For the 18s and the 20s and the 25s going, you would recommend the same for them, that they should have periodic health
18
screening.
years and above, you should have periodic health screening. And there's avenue for that. Fortunately, thanks to the Ghana College, a lot of family physicians are in the system. So you don't necessarily need to come to a teaching hospital to see a physician specialist or a cardiologist to have that screening. Primary health care services are available everywhere in the country. And they have wellness clinics that are set up in various places across the country. Even if it's not a specialized wellness clinic, once you go to the hospital and tell the doctor, I'm here to assess my health, a full assessment of my health. There are a lot of examinations that they'll do. They'll ask you a lot of questions to assess your lifestyle risk. They'll do some examinations, they'll do some tests, and then they'll have a conversation with you discussing overall your risk and what they have found. So that is how you can be diagnosed with this silent killer called hypertension and many other risk factors that are associated with it, like diabetes and high cholesterol and even being overweight or obese.
Let's talk about food and the kind of food that you should eat, especially now that, you know, the Ghanaian is all about fufu and then a lot of carbohydrates. So Amos, a J. Jemfim, a senior dietitian with the University of Ghana Medical Center. Amos, you're welcome to the pulse. If you can unmute for me, Amos. I still cannot hear you, Amos. If you can work on the audio for me so that I'll get back to you to deal with this.
Hello, sir.
Right.
Hello, can you hear me?
Yes, I can hear you loud and clear. So what should I eat to stay safe?
Okay, so as Ghanaians, we shouldn't be modernizing our diet as in following the Western diets. Our local diets are good for us. But it's just about what goes into it. Ghanaians are consuming too much fat and too much salt. Too much of the processed foods, we are avoiding the natural, fresh foods. Those are the challenges we're facing now. But not necessarily going to eat the westernized canned foods and stuff like that, which makes you feel affluent. Not that. Our local foods are good. But just that what goes on the table, I mean, the moderations with which we pick them, those are the necessary bits that we need to consider.
So if you are to give, I mean, me for example, and those who are watching, a week, you know, diet plan, what should that contain?
Okay, so all our foods are good. Let's say in the morning, for your cardioprotective health, as in it helps with reducing your risk of hypertension, you need to look at a cardioprotective diet, which is good in whole grains, less salt. I mean, when we talk of salt in Ghana, when someone says, oh, I just put a pinch of salt in it, someone's pinch of salt might be more than 5 grams of salt, which is a teaspoon. But technically, on a daily basis, it's recommended that you should have about just a teaspoon of salt for the whole day. And it is also not advisable to put salt at table. That is one bit of it. And then coming to the diet, like I said, our usual breakfasts are good, but you shouldn't have the excess of the oils. Assuming I am going for our usual Hausa cocoa by the streets with the kose, we should try as much as possible to get the excess oils out. Maybe you could have some tissue to wrap it in, just to soak a bit of the oils. Because the oils, we know, as our doctors have already said, tend to build up in the system, increase your cholesterol, clog your blood vessels, increasing the blood pressures. That is one. Your routine afternoon wache and shito and all that are all good. But you see, the portion that you consume is the issue. We tend to eat much, excess carbohydrates lacking in our blood will obviously be converted to glycogen that is also stored, compounding the storage of fats, which will eventually also lead to this hypertension. So we must watch our diet, and especially in the evenings, we should avoid the oily soups in the evenings. We should try to go for the soups which does not have much oil on the surfaces.
All right, but
this would help us cut down, and then the salt, especially aside the genetic and other congenital causes that may predispose you to hypertension. Salt alone, cutting down on salt alone would also protect you from, if you've not had it, from getting it, and then if you had the hypertension, from getting you into a bad state. It will help you reduce your condition.
But I mean, I have been listening to you, and you have been very consistent on salt. Is it your recommendation we should cut it off completely?
No.
If you say we should reduce it, to what extent?
We must put some taste in our food. So like I said, if you are not sick, trying to live healthy, at least a 5 gram salt, which is a teaspoon rounded for the whole day, whether breakfast, lunch, or dinner, spread across is recommended. If you're already hypertensive, maybe you should use half teaspoon leveled. And then we should also, as Ghanaians, we Africans, we are used to our herbs and spices. So incorporating the herbs and spices, our lemons in our meal preparations would help us enjoy meals. It will bring out the flavor, and we'll be able to savor the meals without having to add these condiments that tend to worry us in terms of the blood pressure.
I've heard things like you should eat breakfast like a king and then dinner like a slave. But I'm sure you also say that we should consume more vegetables and do a lot of exercise.
Yes, for the vegetables, it has been proven that it helps, especially for the vegetables. They contain fiber that we all know. And then with the fiber, what happens is that when it gets into your GIT, it is not absorbed. It forms a complex with the fats, with the excess fat we consume, and then it is passed out into your feeds. Okay, so if you consume more fat, it creates the bulk that prevents the rapid absorption of the fat and lipids into your bloodstream. You get it? So eating more of the fruits and then the vegetables actually help you regulate your cholesterol levels, and then especially with the salts too. There's a direct link between salt intake and then hypertension.
All right, thank you very much.
The other medical conditions. These two, each check will really help.
Thank you so much, Mr. Dujem, senior dietitian of the University of Ghana Medical Center. And as we are about to wrap up, I mean, let's get practical here. For example, I came to work at 5 a.m. today. I'm still here. By the time I close and get home, traffic and everything, we're around 7 p.m. Leaving no room for any kind of physical activity most time of the week, except on weekends. And I know a lot of people in Accra can relate to this scenario of the day. How do we advise such a person to stay safe?
Okay, so leaving home so early, getting back home late causes a lot of problems. One of those is stress, and then it makes you live a sedentary lifestyle. So some of the things that you can do is make sure that you are eating a healthy diet, like Amos mentioned. So incorporating a lot of fruits and vegetables into your diet. And the vegetables and fruits also contain a lot of potassium, which helps to, when you consume, helps to eliminate the sodium and thereby reducing the high blood pressure. Also, exercise. Most of the time, we give the excuse that I can't do much. So when you come to work, when you sit for an hour, get up and walk around for about 10 minutes, or even when you are sitting at your desk, you can move your legs under your table. Sometimes there are certain little exercise machines that you can have under your desk that you can use. But then also certain things that can help you to move around is if you have a smart watch. It will remind you that you should get up and then move. And then reducing the stress levels, that's something that is a little bit of a challenge. But there are certain techniques that when you visit the hospital, we will be able to teach you to minimize the stress levels. So these are a few things that you can use to help in reducing.
Dr. Kumia, for those who already know that they are hypertensive and they are on medication, sometimes the excuse we get to know is that some say that the side effect, especially for the men, it affects their potency. Do you have a response for that?
Yes, so it's a well-known fact that some antihypertensives can do that in some people. First caution is that not everybody is going to experience that. And the other thing is that it's not all antihypertensives that do that. So there are common antihypertensives that your doctor is likely to prescribe for you. And there are a host of side effects that may come along with it. If you experience any side effects, you have to report it to your doctor, who is then going to assess whether it is due to the medication or something else. Sometimes it's even due to combination of different medications. Right. So they'll assess that and then maybe change the medication for you. Now, the other thing is that hypertension itself can also cause narrowing of the blood vessels in the whole body, including the blood vessels that supply the penis. So you are at risk of developing erectile dysfunction anyways if you do not treat your hypertension.
Right.
And you are also at risk of developing a stroke, heart failure, kidney disease, and all
that is
else
if
you do not treat it. So if you treat the hypertension and you get erectile dysfunction, the medication can be changed or another medication can be given to tackle the erectile dysfunction. So you weigh the benefits and then the risk, and you realize that it is better and safer to treat the hypertension.
Let me pick final talks to Jacqueline as we look into the camera. What are you telling Ghanaians?
So Ghanaians shouldn't wait to get sick before they go to the hospital. Go to the hospital, go and get your blood pressure checked, get your blood glucose checked, get your cholesterol levels checked. Have yourself checked before you fall ill. And then when you have hypertension, take your drugs religiously. The drugs may have certain side effects, but like Dr. Akumia mentioned, the drugs can be changed so that you have better hypertension control, so that you can live a longer, healthier life.
This BP kit that is now available, anybody can buy it and check it. Is it so reliable?
So many of them are. And if you get it from a good pharmacy, you're likely to get a good one. Mm-hmm. You can also check it by using it and also using something in the pharmacy or in the hospital. Then you can compare. It's a sort of way to validate it that it works well. And you can use that. There are newer ones. Some people have watches that check blood pressure. I mean, technology is advancing. But as much as you can, if you get a good arm cuff one, is good. There are wristband ones that are also working. So any of it is fine. And if you go to the hospital...
What time is it good to do the check-in?
Okay, so blood pressure usually is higher in the morning than in the evening. If we
the time you wake up?
Yes. Mm-hmm. If we are trying to diagnose it, we usually let you check both morning and evening for a while, maybe about 2 weeks before we assess the trend and see whether you have hypertension or not. So you could check it both morning and evening and see whether it's high or low.
But you cannot even determine whether you have it high or low, so, depending on the figure, because yes. I mean, because of the availability of knowledge, there is a category. If you fall within, you know that you are in the danger zone.
Yes.
You are not in the danger zone, or you are in the safe zone.
Yes.
You on your own can do the calculation and say that I'm safe.
Okay.
But you still need to go to the hospital and have it, reviewed for you.
So when you check your blood pressure and you are getting values that are 130 and above, it could be a red flag. In Ghana, our diagnosis of hypertension is when it's 140 or 90 and above. Right. So the upper one, if it's greater than 140 or equal to 140, and the lower one, figure, if it's greater than or equal to 90. That's when we diagnose. In the US, they diagnose it at 130, 80. So that is the difference. And for us, we say that if you have 130 and 80 and above, then it's a red flag. Right. So you need to go to the hospital. They will check you for other risk factors. And if you have those risk factors, it even increases your risk. So that will determine the intervention that is done for you. So it's good to check on your own. If you notice that your blood pressure values are high, you go to the hospital with a chart, you speak to the doctor, and he does all the necessary things to add on to that.
Dr. Florence Akumia is a cardiologist, and of course, Dr. Jacqueline. Thank you so much for coming through as we celebrate World Hypertension Day. Folks, so this is a very important subject, and I'm absolutely certain that we're taking some lessons from this as we all take care of our health. Let it be a call for you as you go into the weekend.